Nearly 28 million Americans suffer from COPD, a condition that makes it quite often very difficult to breathe and just to go about everyday activities. To talk more about that, we are joined by Intermountain Healthcare Dr. Suresh Tani, who is a pulmonary physician at Intermountain Healthcare. Thank you so much for being here, Dr. Tani.
Thanks for inviting us.
Let's break it down. What is COPD?
So COPD stands for chronic obstructive pulmonary disease. It's a very common respiratory condition. Now COPD actually is a preventable and treatable disease, and it is caused because there's a damage to the bronchial tubes and the alveoli. And because of that, patients have persistent respiratory symptoms like shortness of breath, cough, tiredness, and fatigue.
So how does one know that they have that? Is it something you have to go through tests to determine if you truly have that?
So when you see a medical provider, you have a history examination, and then you have to go for a breathing test called a spirometry test. The breathing test is a pretty simple test. It's a painless test, which is performed by a medical care professional person, in which you're breathing through a tube, and then you blow out as hard as you can into the tube.
Yeah. And at Intermountain Healthcare, you have a whole team that works on this.
Yeah.
So one patient gets to see a lot of different people, and that's great because you have different minds joining in.
That's correct, yeah.
Yeah. And what are some ways to prevent COPD?
I mean, the main thing that 80% of patients in the United States who have a COPD, they have a history of smoking cigarettes. So you know that cigarette is the main cause for this COPD. So main thing is to avoid those cigarette smoking. Also from the air pollution, also exposure to the chemical dust or fumes in your job as well as into the outside, that can also cause COPD too.
We mentioned the millions of Americans who are dealing with this. Is the number increasing after COVID? Is that a byproduct of COVID?
Of course, definitely because of COVID also. COVID doesn't cause COPD, but is a risk factor. Any kind of infection can also cause, is a risk factor for COPD.
Yeah, so it opens the door for that. What are some things people should know about it that maybe they don't know otherwise?
I mean, if you're getting if you have a risk factor like a cigarette smoking, and you're getting tired, fatigue, you're having a cough with some sputum production, you're getting some wheezing, we would suggest that you should also get a medical attention for that.
We mentioned the team that patients deal with at Intermountain Healthcare. Who are these people and what are the different roles they play?
So in our the COPD clinic team, we have medical provider, which is me. Then we have a nursing manager who has expertise in disease management. We have 2 respiratory therapists. We have 1 care manager. We have 1 medical assistant and 1 care manager assistant. So it's like a team of 6-7 people together working together.
And so are treatments advanced enough that the symptoms can be alleviated, or is it just something that is diminished once you have COPD? I
mean, its symptoms will diminish so the patient can breathe better actually, So they are most of the time we give them some kind of inhalers, to improve their symptoms. We also send the patient for rehab. We also make sure the patient gets vaccinated for the flu vaccination, pneumonia vaccine, COVID vaccine, Tdap. We send the patient for rehab. We also have the patient who might need some oxygen.
So all those things can make a huge difference in the lives of patients. Dr. Tani, thank you so much for being here today.
Thank you.
Really appreciate it.
Thank you for inviting us.
Thanks again to Intermountain Healthcare for sponsoring this segment. If you'd like more information or if you want to make an appointment, you can visit the webpage that is listed right there on your screen, intermountainhealthcare.org/Nevada. We'll be right back.